Hello, Get Better Faster Nation. I am Dr. Jason Bradley, and along with my co host, the one, the only James Chester, and our incredible executive producer, Rachel Bradley, we want to welcome you to another exciting episode of the Get Better Faster podcast. Today, we're joined by Angie Mariānanda. Angie is a functional and integrative dietitian, shamanic practitioner, and guide for people moving through major life thresholds. Her work weaves together self observation, nervous system awareness, nature-based wisdom, and spiritual integration to support people navigating periods of profound change. We're talking about those moments when old identities dissolve and new ways of being are not yet fully formed. After nearly 2 decades of individual healing work, professional training, and lived experiences, Angie now focuses on creating grounded, ethical spaces for integration, especially for those who have felt misunderstood, destabilized, or alone during the transformational process. Her approach emphasizes discernment alongside intuition, community over isolation, and growth through compassion rather than bypassing. Angie serves people facing transitions such as grief, illness, divorce, spiritual deconstruction, relational rupture, and other dark night experiences. She helps them stay oriented, resourced, and connected to what's true while moving through the unknown. She's currently living in Costa Rica, where she's cultivating a community-based container for collective integration and support through life's initiations. Without further ado, Angie, my friend, welcome to the show.
Hi, Jason. Hi, James. Thanks for having me.
Well, it's really nice to have you on. It's cool to have you coming in from Costa Rica.
I love coming in from Costa Rica. It's the best move ever.
It gets dark every day at what time?
Oh, yeah, that is a little bit of a downside. Yeah, it gets dark around 5:30 all year, all year.
Oh, yeah, I know.
But it's good for the circadian rhythm.
So you started out in dietitian work.
Yes.
And I know that you said off camera you're evolving all the time, like minute to minute, day to day. How would you pre-frame your positioning and a good title for the work that you're doing now?
A title? Oh, don't ask me to come up with a title.
Well, from the intro work that I have on you, it said that you call yourself the deep dietitian. Is that still accurate?
It exists. It was that was a what was that? That was a moment. It's still there. I just haven't been putting energy into it because I started to feel like even though I was calling myself the deep dietitian, it starts to feel too focused on the food. And I've had that with people where it's like there's deeper work to do, but they want to focus on the surface and it becomes a distraction. So yeah, it's not deep dietitian. I would say currently I call myself a sacred thresholds guide. Um because and even my nutrition clients, I work as a dietitian online, a functional dietitian. They're all if I start when I start asking questions about, okay, well, what's going on in your life, like what's happening or what was happening when this all started, it has to do with a major transition, typically, like 9 times out of 10. So even as a dietitian, I'm supporting people through big life transitions and initiations.
Well, it makes me think more on the terms of you're now getting access points of the food, but you're also getting the aspect of the mental, and you're getting aspect of the spiritual. When did you first know that you could combine the alchemy of, food ideas, mental state, and spirituality and actually get people better faster?
Good question. Well, I think it would have been during the time when I was really delving into creating a practice where I was working with a lot of women with irritable bowel syndrome, autoimmune conditions, particularly a big focus on Hashimoto's. Um, and other inflammatory issues. And what I was realizing is that, oh, I can design all these really top-notch, cutting-edge protocols and, like really get in there with those physical root causes. But what I
Mhm.
started to notice was that they would only stick with it um to the degree that they had that they knew how to say no, that they knew how to set boundaries,
Mm.
that they had healed or at least were receptive to healing um, their trauma. And so I then became very interested in and realized too that as a dietitian, I mean, they didn't train us to do the deeper counseling that people
Mm.
really need. And so I found well, first it was transformational coaching. I dove into that, and then I met my mentor of 10 years through that program, and I became certified in transformative coaching is what he called it. But yeah, definitely more on the transpersonal side of things, not coaching as in, oh, do this, do that, we're going to get you from A to B. No, this is slowing down,
Mm.
connecting with your breath, tuning into your intuition, and also learning how in the first place your experience is created from moment to moment. So really getting to that art of self-observation and then deep listening to what the body is actually reflecting for you through these symptoms. That's how I started to merge it together.
I think it's really interesting that you mentioned all of that, and thank you. Uh,
Mhm.
I I have said many times I've been working with my clients and my team working with my clients for over 2.5 decades. I don't feel that old, but I when I think about 26 plus years, kind of in the trenches, it's a long time, and if I
Mhm.
step back from that and I start looking at kind of like threads or connections, so to speak, connecting some dots. I've come across the same conclusions as well. From a functional medicine point of view, I specialize. I don't even like that word anymore. I'm going to say functional health. I'm changing it right now. I'm gonna try to own that.
Like it.
Just because medicine has been co-opted. We had a
Mhm.
discussion on one of our previous shows about that word. Unfortunately, it's a beautiful word, but it's been co-opted, and so I'm not going to use that. But functional health. I'm a wizard at Hashimoto's, myself and thyroid issues. I mean, that's what Rachel and I do, Dr. Rachel and I do
Mhm.
every day. Um,
Mhm.
and if I go back 2.5 decades, I mean, it was like, well, let's find you the right, whether it's a glandular or supplement or whatever that's helping your thyroid out to work better. And then it translated into, well, what can we do to, help the immune system? Because really Hashimoto's, as we know, is not a thyroid issue, it's an immune system issue.
Mhm.
And what can we do to help regulate that immune system, so it's not attacking the thyroid anymore. And then it got into, well, why is the immune system so messy, and I started realizing a pattern. And you know what, I said it this morning to Dr. Rachel and one of our assistants when I was working. I think I was right, I don't know, doing a review or something, or helping guide someone on something. But nonetheless, I said, man, the common thread that I see over and over and over again is a hypervigilance in the immune system. And if I have to break that down, really it's a trauma response. And I want to be
Mhm.
really clear that I'm not saying everyone with Hashimoto's or an autoimmune disease has a history of trauma or PTSD or something like that. But you know what? A lot of them do. A whole lot of them do. And especially if we get into
Mhm.
women, which is,
Mhm.
primarily Dr. Rachel and I work with, women struggling with these types of things, autoimmunities, whether it's hashies or something else.
Mhm.
When we start peeling back the layers, we start finding trauma after trauma after trauma. And sometimes they're even
Yeah.
in ongoing traumatic environments. I'm
Mhm.
not picking on husbands, but most of them can, kiss off, to say a better word. God bless everybody. But I mean, a lot of these women don't have the support at home. They're
Mhm.
misunderstood. They're not heard. They're not seen,
Mhm.
and they're still dealing with adverse childhood events and previous, traumatic experiences that caused, in my opinion, that nervous system to be hypervigilant, that
Right.
caused that immune system to get confused and be hypervigilant
Mhm.
and attack the self. So I'm really feeling what you're saying. I mean, that really resonated with me and my experience over 2.5 decades working with uh, women as well. So I didn't really have a question with that, but
Yeah.
I will say that my work has morphed as well into we still want to help balance the system, get the bad stuff out, put the good stuff out, and get them on the right diets and moving and drinking enough water with electrolytes and all that stuff that we do right to get
Right.
people better. But really, it's in between the ears. It's that sense of self, that self observation, that piece of understanding oneself, that and like you said, being receptive to healing, because so many people are so locked into, I am this victim, I have this condition, it's being reinforced by the medical establishment because they tell me there's no cure for it. I take all the medicines and do all the stuff and I don't get better. My husband now thinks that I'm crazy because everyone else is telling him that they've balanced out this and that and they can't find anything with my lab, so it must be me, and here's my psychoactive drugs that they put me on, and I still feel like crap. And it's just interesting. Something resonated with me there. James, I saw you tell me that you have a question. Sorry, go ahead.
I'm curious. I have a question to field to both of you.
Yeah.
I think you said, Jason, your primary client base is women. And Angie, would you say your primary client base is women also?
Yes.
Why do you feel that women are the ones that want to come in and investigate what's going on with their spirit and body and food connection and their health connection, where men are just like, hey bro, I'm just gonna go hit some weights or just get fat and retarded? Like, I don't know.
Listen, as a man, I know that I can speak for women. I just want to say, I'm teasing. That was a joke. Please. I have my thoughts on this, and I don't want to. I will share them, but I want Angie to answer this.
I think it'll be good for both of you to weigh in on this because I'm curious, because I don't hear about this being like pathway for guys that are jumping on board. And take the PC out of this conversation. But I think more guys become feminized and they don't know how to discuss their feminine, like their transition into this feminine, like masculinity rather than masculine masculinity. But they don't want to talk about that stuff either. So I'm
guys
just
don't
curious.
have feelings. That's what you're saying. We don't talk about feelings.
Well, I'm just curious how women are like interested in their health on this level, where men are just like, cool, I'm fine.
Wow, that's so much to share.
Or I'm just gonna ignore the person in my life that I'm supposed to be connected to as a partner in love, and I'm not gonna really be interested in what their real issues are. I just want to make sure that they show up when they're supposed to, and life goes on.
Oof. Preach. Wow, there's so many layers of talking points there. Okay. First of all, for women, my perspective, is that, we see a lot of women showing up, wanting to do the deeper physical and open to doing the emotional, spiritual work too, being open, to that mind, body, spirit connection. And my sense is that because, we're emotional beings, and it's our superpower. We know how to feel. And whereas men are not only, they're less emotional beings, but they're also told and indoctrinated into not feeling, that it's actually, they're less of a man if they show their emotions. And so I think it's partly biological, archetypal, but it's also cultural, um, where it's just not okay to go there. And so they learn to shut it down and ignore it, right? Um, at the same time, a lot of women learn that too, or taught that too, right? I work with many women who they're feeling, but they feel like it's not okay to feel, right? Because women are labeled hysterical, crazy, like too sensitive when we're feeling, right? And especially if we're, not just emotionally, but physically, if we're having symptoms that nobody knows how to address, then, egos are threatened, and they're just told, we don't know what to do with you. And they get the
Mm,
sense that there's something wrong with them, right? And I will say, though, that if an adult woman feels like there's something wrong with me, um, because I'm having these symptoms, because I'm having these emotions, that's this started early, 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 right? And she picked up that programming that there's something wrong with me.
mhm.
Um, and so we actually all do that, right? And it does get projected onto our emotional state, our physical state, any way our egos can project that out, and color our experience in that way, they will.
Absolutely.
Hmm.
If I can jump in, is that okay?
Hmm.
Yeah. I just want to say yes, ditto to all of that. I mean, you encapsulated so much from a couple of like I'll take a step back from that and I'm gonna dive deep with you. But just from like a female male point of view, just generally speaking about bodies, women women have periods. I mean, they menstruate, and so every single month
Hmm.
there's a shift in hormones.
Hmm.
And I
Hmm.
mean, we all know there's a bunch of symptoms that can come along with that if your
Right.
body isn't regulating well. And a lot of times with all the dysregulation and toxicities and stress and all that, I mean, sometimes there is poor regulation. Many times there's poor regulation. So we get diagnoses like PMS and PMDD and all this other stuff. So we get that piece of it. But the reason I bring
Hmm.
that up is that women, to a certain extent, are just with biology, are they get more signals from their bodies regularly than men
True.
do, or at
Hmm.
least
Hmm.
they're programmed or trained to be sensitive, at least to those body changes. I mean, it
Yeah.
just happens, Men really we cycle too. I mean, we all know that. Everybody on the call knows that. But maybe our listeners don't know. Men cycle too, but it's in different ways. It's not
Hmm.
monthly. It's just different. But the other thing besides that, men are, at least where I grew up, and I know where James grew up, if something goes wrong with your body, I mean, if you get hurt or something, I mean, you just walk it off. Like get up, like walk it off, if
Hmm.
you're in sports at all, I mean, it's like get back in
Hmm.
the game. And it's there as James was alluding to, trying to not be PC. I think with men, there's not a lot of opportunity to talk about this is the way I feel. Because I mean, no matter how our society goes and we're these words are so I feel confined by words sometimes. So please everybody excuse me for my words, but Jim, I'll quote James. With masculine masculinity and feminine masculinity, no matter where we are, I think there's still a lot of stigma around men being sensitive and men being
Hmm.
open about their sensitivities. And also, as we know, a lot of men don't have other people to talk to. I mean, they really don't. I think it's over 50%. I don't know if it's 51% or 54%, but more than half of men don't even have another male that they could call and have a deep conversation with at all
Yeah.
in their life, at
Hmm.
all. I'm
Hmm.
blessed that I have James in my life. We connect at least once a week, if not more, and we actually talk about stuff, not just work stuff, but like how do we feel? What's going on in your life? How can we help each other? And it's called the brotherhood call, but it's very important. But men don't have that.
Hmm.
So on coming back to what Angie was saying, on this other like weird bizarro world that we live in, women are told that they're hysterical. I mean, if we think about the hyster and a hysterectomy, I mean, we're cutting out the hysteria of
Hmm.
the woman. I mean, it's kind of a weird word for me
Hmm.
that we combine those. But I mean, if we think about
Hmm.
that, we really are removing the idea anyway, that we're removing the hysteria from the woman. We're cutting out their ovaries and their uterus, and this is the hormone making that makes them feminized, that makes them women.
Hmm.
And I think that there's a loss there. That's a very masculine approach to. I'm just saying, if people came to men and they're like, what your problem is, we need to cut your balls off. I'm just saying, like, you're not going to have a lot of men lining up for that. But I can't tell you how many women that we meet, and I ask them like, why did you get a hysterectomy? And like, I was just bleeding a lot, and they couldn't figure it out. Which brings me back to my other point.
Hmm. Hmm.
And I'll finally pass the baton over. I have 2 points. when in the medical system, unfortunately, we are all trained as for having a God complex. And I mean this out of due respect for myself and my colleagues and everyone else involved. That's a quote doctor, whatever that word means these days. I think it means teacher, but that's not the way it's practiced. Doctors have a God complex, and there's a reason for it, because if you're having a surgery and there needs to be a nanosecond decision, life or death decision, you want someone confident enough to make that decision right then. It's a God complex. I mean, you got to be that sure of yourself with what you do. The problem comes in that a lot of these conditions that we're talking about are symptoms. I don't even like conditions, but symptoms that all of us struggle with, but with women, they're not life or death at that moment. They're more chronic and they're more insidious. And doctors still approach this, male and female doctors, both approach this as though I'm the God. And since I can't figure out what's wrong with you and I know everything, it's no longer my fault. It's your fault. And you must have a psychiatric condition. So here's a psychotropic drug to numb you into oblivion so that you just don't care anymore. You still feel like shit. I mean, I'm sorry. You still feel like crap. I'll edit myself. We still feel like crap, but you don't care about it as much. You're apathetic about it because you're taking a psychotropic drug. And that's really the way women's health is approached. I mean, it's very different. And in my opinion, it doesn't matter if it's a male practitioner or a female practitioner. It's just the way people are indoctrinated, which leads me to my last point, and then I'll pass it over to James. You talked about programming. It's so true. And I think that my new job, I mean this, for myself, for the light that's within me, I am unlearning that programming. It's all I really focus on is trying to understand the programming. And I think if I can see it, that's the first step, is observing it and then stepping away from it. So I can say, like, wow, look at that programming. And the more I do that with myself, the more I start to see patterns of programming in my family, in my friends, in my colleagues, my coworkers, my clients. And it starts to open up a whole new world of, what's the word I want to use here? Integration. I was going to say intervention, but it's more like an integration of helping people understand that. But it's hard because that's a whole conversation most people aren't even aware that needs to have happen. So I'm going to end there. Unlearning is my new job. Unlearning. James, go ahead.
Well, I want to bring it back to Angie. There's a lot that you guys both shared when it comes to the dynamics of understanding how one person comes into a situation. I like singular situations at this type of conversation, because so many times we start to generalize women or men rather than the individual. And I think that we sometimes lose it in the semantics of it's just a woman thing or it's just a man thing, but really it's an individual. And it's like saying that if you do this, you're going to get a six pack in your abs. Like, when does that start and when are you satisfied and when does that finish? Like if you tell somebody you have to do this, you're going to get a six pack. When does that start? When are you satisfied and when does that finish? It's like taking somebody through the dietitian phase. When does that start? When are you satisfied and when does it finish? It takes the harmony of the spirituality along with that. When do you start? When are you satisfied? And when does it finish? Like, all these things are very relevant to that individual, because the Western medicine world, they don't tell you this is when you start, this is when you're satisfied, and this is when you finish. It's we're going to do this until it burns out, then we're going to try something new. And if that doesn't work, we're going to try something new. So there's just this evolution of trying something new where nobody ever starts and is satisfied, never finishes. So you start thinking about the component of the spirituality with the mental aspect of this, along with the food dietitian standards. When do you see people actually getting satisfied? When do you see people actually, or the individual, when do you see them actually transitioning to this point of like, wow, that was the best thing I ever did in my entire life. Why didn't anybody tell me about this sooner?
Yeah. Well, I see people reaching that when we are able to integrate, the emotional with the physical. Um, Although I will say that, I mean, as a dietitian, one of the main things that I work on with people is blood sugar regulation, because it's the one thing that, I mean, it pulls so many different levers, and I've come to realize that even with the people I'm working with, just on a more like transpersonal level, I also need to talk to them about what they're eating and what they're, and help them regulate their blood sugar. Um, so when we're able to do both, like that's when people are satisfied. And people come in with a goal first, like, oh, I want to lose this much weight, but really they're satisfied when they actually just start feeling better, right? And having more energy and sleeping through the night, and just feeling rested and at peace, and their cravings go away and they stop having the urge to binge, things that they thought would never change, and that they were always just told, like, there's something wrong with you, you just got to stop, you just have to stop, but no actual guidance on how to not feel how they feel in the first place, that leads them to, let's say, binging, because I see that a lot.
So you get them to this point.
Hmm.
How do you find that individual that knows all that you're sharing with them, has the desire to drop that weight, or has the desire,
Hmm.
but there's still something in the resistance model within them that they're still
Hmm.
binging? Like, how do you get that
Hmm.
last piece to the puzzle to fit in to where they're like, okay, I'm not going to eat dairy anymore. I'm going to,
Hmm.
only eat, vegetables and meat, and I'm going to cut
Hmm.
out dairy. I'm going to cut out all the junky pastas and all the
Hmm.
chips and all the snacking and all the ice cream. How do you get that person to actually take that last piece to the
Hmm.
puzzle to where they get that like exit velocity that now they're
Hmm.
satisfied and it's like something that they're
Hmm.
comfortable with for like a long-term commitment?
Yeah. Well, depending, I mean, we start with the blood sugar always. But I will say I have some people who, I mean, I've worked with them for months before they actually, like, let's say a patient that I'm thinking of, I usually say client, but in this situation, we call them patients. But she has, an autoimmune well, let's see, she has Hashi and also rheumatoid arthritis. And so I was really trying to educate her about gluten and how that, may be affecting her pain levels, her thyroid antibody levels. But it's so ingrained because she's Italian, and also there's a lot of enmeshment with her family, and they weren't supportive, and like they get together all the time. And so I just meet people where they're at and what they're willing to do, and just chip away at it, get them feeling better and better and better, until finally it's like there's nothing, it's like that's the last piece. And then I bring it back, and I'm like, okay, so here we are again with this. If you really want to feel better, I highly recommend, like even just doing 2 weeks without gluten. Let's just see, and then we'll take another medical symptom questionnaire in 2 weeks and see how your symptom scores have dropped, like,
I
um,
I
mhm,
think that's a really solid strategy because I think a lot of times when somebody's in your chair or Dr. Jason's chair and somebody
mhm,
comes to them with some type of entrenched issue,
mhm.
the practitioner's just like, just fucking do it. Like, flip the switch and start thinking
Yeah.
differently, start behaving differently, start shopping
Mhm,
differently, and start eating
mhm,
differently, and create
mhm.
yourself this new reality that you don't know how to even exist in. But I'm going to tell you what to do just because these
Mm,
markers aren't lining up for what you
Mhm.
want. Like, we don't want
Yeah.
that marker to be where it's at, but
Mhm.
you don't know how to be this new version of yourself. But I'm just going to tell you to go do that version of yourself because that's
Right,
what I want to see change on your next lab. So,
right,
damn it,
and
I
I
don't
just
care what your headspace is. I don't care what your mentality is. I don't care if you want want it or not, this is what you have to go do it. And now this is your new reality. And then you press that onto these people, and then they're like resistant because they don't know how to react to that, because they're like, I don't know how to be a new person.
Exactly. Yeah. Yeah. And meeting someone where they're at. So I will say this before I hand it over to you, Jason. I really prioritize establishing rapport, and also like what I learned in my, training as a transformative coach was that infinite patience, this comes from A Course in Miracles, infinite patience yields instant results. Right. And so if I allow someone to be right where they're at and see them in their perfection, and actually affirm to them, you're right where you need to be. We're here now, like this is, whatever you're willing to do right now, that's perfect. Let's just make these shifts, right? And trust the process. It is a process. So I'm here with you. There's no judgment. And when you're ready, you'll know, and I'll be here to support you. And that goes a long way.
Well, I know Jason wants to jump in on this.
Yeah.
What happens when somebody comes into you and you're going through this infinite patience yields instant results method, and somebody ghosts you for 2 weeks? How do you deal with that type of a situation? Because these are real things. It's not just, we're not talking fluff here. We're talking like when somebody has a real concern and they have a hyperthyroid issue, or they have a gluten intolerance or something like that. But you're talking about helping people with this like spiritual component and this emotional component. What happens when somebody is emotionally withdrawn and they don't know how to reconnect to you because they feel more guilt because they've hired you? They have more shame because they're not following through. And how do you bring them back from that abyss to say, okay, we're going to get you back on track?
Yeah. Well, if they're not showing up, then I'm reaching out and, encouraging them to, like, they'll say, oh, I can't right now because this or that, and so I will just say, actually, your health is the most important thing. You're the most important thing. And I really want to encourage you to honor the time that we set together. Right. And so, but, if somebody is withdrawn, it's not my responsibility to heal them. Right. Like, it's their responsibility. And if they choose to keep showing up, great. But if they don't, I don't have any control over that. Right. And so I put my energy into the people who are, and trust that when these people are ready, they'll either come back to me or they'll find somebody else who's more aligned. I don't chase people or try to pressure them or guilt them.
I hope that was a fair question, just because I know that
Yeah.
this type of stuff comes up in real world, not just you, but for Dr. Jason and for all the other people that are practitioners that listen to our show. This could be like the aha moment for them to be like, oh, that's how I deal with XYZ person. This is how I deal with this type of scenario. So really, this is like real life coaching for people that are in the same fields as you and Dr. Jason, to say, okay, this is how I can help navigate these situations better, to where I'm not chasing and I'm not pressuring, and people will find their own course of response when it's time.
Yeah.
Right.
And then when somebody shares something that, oh, I did this, or, at least they've shown up and they're like, oh, I feel horrible about it or whatever. I am not judgmental. And I just ask, like, okay, this happened. And how did it feel? I just bring them back to, how did that feel in your body? Yeah.
There's so much here. I'm going to jump in real fast, and then I think we have a comment that we should address too, from Stacy. But it's interesting. You talked about judgment. Dr. Rachel, our incredible executive producer, and my far better half, my wife, she has a statement where she always says no CCJ. And CCJ stands for criticism, comparison, and judgment. No CCJ. I mean, and we try to live our whole lives like that. And our whole family we call each other out on it when it seems to be happening. And judgment's a big one. Comparison's a big one. Self-criticism more than anything else too, So at any rate, I really appreciate that. But coming back to James, what you were asking, and I didn't write down exactly how you worded it, but you're like, you go to a practitioner, you've got these issues, and they're like, here's what you need to do, just do it, and for some reason they don't do it. I had the privilege a couple weeks ago. Time is kind of fleeting to me, so I don't know if it was 1 week ago or a month ago, but somewhere in the last month, I attended a Tony Robbins event, and I'd never attended one before. I'd never seen Tony Robbins speak live, or I've seen recordings and stuff around, but it's an amazing event, a 3-day event that he and his wife Sage put together. And the whole thing was around the 3 S's. And I'm going to do it the way Tony did it, and which I think explains why people fail to do the push-ups. I'm teasing, but we were talking about, we can teach them how to do the push-ups. We can show them how to do the push-ups. I can show them all the research of how it's going to help them. But ultimately, our clients, Angie, have to do the work themselves. They have to do it. I really wish that I had some ability to just lay my hands on people and hallelujah, all your ills are gone, right? But I mean, even Jesus in the Bible would ask people, do you want to be well? I mean, do you want to do you want to heal? They have to be willing. So Tony Robbins said there's 3 S's, and the problem is most practitioners start with the last S, which is strategy. What do I need to do? Right. And that's really where they start and stop. It's strategy. Let me lay out this whole thing. This is what you need to do. And now go do it. But the problem is the second S can get in the way. And the second S, so that was the third S, strategy. All the knowledge in the world, right? Not implemented. The second S is story. And that story is what's between our ears. It's that narrative that we tell ourselves all the time, right? This is hard, well, everything's hard. I mean, you choose your hard. I mean, it's hard to have symptoms and feel like crap and be in pain and have brain fog and depressed and, unable to lose weight and have no libido and have your relationships falling apart. That's hard too. Making changes to, diet and lifestyle and taking maybe some supplements or doing some meditation and breathing and, yoga or whatever it is, that's hard too. It can be. I think it's fun. I think that stuff's fun, but, that can be hard too. But we tell ourselves these stories. I call it the false narrative. Tony calls it the story. But it's what's in between our ears. It's I'm not good enough. I don't deserve this. People aren't, I don't have support around me. On and on. It's these stories. And when we tell ourselves these stories, especially the false narratives, the negative diatribe that's in our head. I have it. I don't know if you guys have it. Even with all the unlearning I'm doing and all the training I've done and all the gurus I've worked with, I still fight those goddamn stories every single day. Every day. I now get to say, no, that's not real. That's not true. I hear it. And you'll see, if you're around me, James has seen it. Rachel sees it all the time. I'll in the middle, like chopping up something, some cabbage for dinner. I'll literally say the word, nope, that's not real. And they're like, what are you talking about? And I'm like, I'm just telling myself something. It's all good. But the other thing is, even with the story, to have that recognition of a false narrative, Tony says we have to be in the right state. And you mentioned earlier, we have to be receptive. We have to put ourselves in a receptive state, right? And also in a strong state. It's interesting. We have to be strong, but also receptive. It's a yin and a yang, right? I mean, it's a little bit of both. And the problem is being receptive is vulnerable, right? And if we come back to our clients, Angie, women, of whatever age, mine are 30 to 60-year-old women with chronic health issues, mainly autoimmunity, mainly the ashes and thyroid issues, but it all blends together. It all blurs together. When you have to put yourself in a vulnerable state to be receptive to even acknowledging that the story that you're telling yourself could be wrong, right? Or false or misleading, the strategy is never going to work. And the problem is putting yourself in that vulnerable state. It's vulnerable. And if you've gone through trauma, experiencing either past or current PTSD, you're not in a supportive relationship. I mean, all this stuff feeds into that state. And so Tony says, for those of us doing coaching, whether it's transformative coaching, transpersonal coaching, whatever it is, thank you for the words, by the way. He's like, we need to flip the switch or flip it around, flip the script and start with state. Helping people feel strong enough, empowered enough, supported enough to get into that receptive state. Then start unpacking the stories and flipping the script on the stories, and then lastly, after that, we're going to have success with our strategy, because when you do that, of course you can do anything. Anything's possible at that point. But again, the problem is, in my opinion, and then James, I'll pass it over to you. The problem, in my opinion, is that we're told that in 30 minutes or less, including 12 minutes of commercials, we can solve any major life dilemma. And so people want that strategy. I want to do it really fast. I want to do it really fast. But my experience has been, it takes months. I mean, we get some gains. I mean, we can have wins, win after win after win after win, before that full transformation, at least in my experience. I'm usually working with my clients, 6 to 8 months to really see. It's not like they're feeling bad, and then 6 months, and then, oh God, I feel better. No, you're feeling better along the way, but you're also being stronger. You're also being more receptive. You're surrounding yourself with a healing community of people that support you and love you. You are starting to implement some of the strategy. You have worked on the stories, and the more I spend time in that, it's a slower process, but the longer I spend time reinforcing that with our clients, the more success we get. And I wish I would have known that 20 years ago. I mean, it's really my new way I practice over the last, 10, 15 years. But anyway, thank you for letting me have that, soliloquy again. James, right over to you, sir.
Yeah, I want to ask you guys both. I like this format. I'm going to pose another question to both of you again. So when it comes to communication styles, women have different communication styles than men. Jason and I sometimes joke around. He'll send me something that's like 10, 12 pages, and we have this little acronym: too long, did not read.
Love it.
And I'm just like, I'm not reading that. It's too long.
I put hours and hours of work into the documents I send over, but I have a TLDR for James now. I know what he needs. So.
I'm going to start using TLDR.
But when you think about like connecting with these people that are in your zone of influence, how do you get best results? Is it through text message? Because I know that people, some will respond well to voice messages. Some will respond well to like in person. Some people respond well to email. Some people listen better. Like we either read better, we listen better, or we watch better. How do you find yourself connecting with the people that you get greater breakthroughs with? Is it through each person has a different type of learning capacity? How do you identify that with them?
Well, in the practice, so for the nutrition work that I'm doing, I work for a private practice, and I have sessions with people that are scheduled, and they're video sessions. So yes, we have, messaging through the platform, or texting. But I'm going to be honest, like I am an independent contractor, and I'm paid for the time that I'm with them. So I'm not spending a lot of time, because I healed my adrenals. Okay. So, so I'm not constantly texting with people. I'm not available for that. In my private work, when I was doing more of that, yes, I am available through texting, messaging, voice notes. I'm available for that as well. Yeah.
But I guess my question better is, how do you break through the matrix of communication to get that person better faster?
Well, I would say I'm limited to mostly the time that we're together. right? And face to face on a video. Um, but it's really not. I think it's more of a frequency, you know. It's more of that um, the rapport and being that non-judgmental space.
Well, I think this might help speed the game up for everybody
Mhm,
based on what you're sharing and what my
mhm,
question is, because we're gonna get to Jason
mhm,
eventually also, is maybe we should start working with people with the mindset of asking them, how do you respond better to
mhm, mhm,
written documents,
Mm,
video instruction, or auditories? So like listening, because some people, like if you sent them like a 9-page document, they're never going to touch it. Like they're already
mhm,
checked out.
mm,
But if you
mhm,
sent them like a 4-minute audio on the same thing, they would listen to it
mm,
while they're walking around their house folding laundry, which they would then actually, consume
mm,
the information.
right.
Or some
Yeah.
people are watchers. They might throw it up on their,
Mhm,
their phone or their computer screen and watch something for like
mhm,
6 minutes
mhm,
and consume it that way. So I just think that if we really want to get to the heart of how to best interact with the people that we want to see the results from, we have to really consider how we communicate with that
mm,
person. Because
mhm,
if we learn their communication style, then we can get their breakthrough that they're looking for, and they'll probably take the coaching and guidance that we deliver to them on a whole
mhm,
different trajectory with better outcomes and
mm,
better uptake. Just my like ideas around the concept of being virtual clinicians,
mm,
both of you guys are, is everybody needs to have a learning code. And if you don't know their learning code, you're
mhm,
never going to get them to show up and have that consistency
mhm,
and that rapport.
I think that's
mhm,
I think that's super interesting. And actually, now that I think about it, I think you got James, you brought this up to me before. And I'm gonna have but I didn't really put a lot of thought into it. We just kind of cursed over it. I really appreciate the question because I do think you're right. There are different healing styles for different people. And I think that's a very true statement. Some people are readers, some people are auditory, some people are visual, some people are, probably touching, tactile. I'm sure there's a lot of different, healing I'm sorry, ways of learning. And it's curious because what I found and I'm very blessed. Dr. Rachel and I are very blessed. We have a team that we work with. When it was just me, and I had kind of an admin support team many, many, many years ago, it was a lot of just like Angie was saying, there's only so many daylight hours. I mean,
mhm,
and to a certain extent, squeaky wheel gets the grease. People that are participating, people that are coming and asking questions, people, they're going to get your attention, and that's just the way life works. It's just the way that it works.
mhm,
The same thing when I was teaching at in the J school at the Adler School of Journalism, the second top ranked school of journalism in the country, right after Columbia. I just like to say that. But I was privileged to teach there for a little bit, medical reporting and writing, and it was interesting because I would have students that maybe they were A students. I mean, they were great writers, they were great journalists, genuinely good, like doing good work, and they deserved an A, I'm sure, but they didn't participate at all in the journalism community. They weren't participating in class. They never came to office hours. They were kind of phoning it in, but it was good phoning it in work, but kind of phoning it in. Then I had other students that would um, come all the time. I mean, if I had a couple office hours a week, I mean, they were in there, same people all the time. You read through this, give me edits, and then they would edit it and come back. And despite their very best work with edits and help, it was maybe like a B- student. And I always felt maybe not even, maybe a C+ student, but they were working so dang hard that I wanted to reward them. And they did get more of my time and more of my attention and more of my energy and more of my guidance.
mhm,
And it's like, despite their best work, maybe they weren't, A students, but God, they were working hard and they got good results, and their work improved, and they improved by leaning in. If those C students would have not leaned in, they would have been F or D students. I mean, it's just the reality of it. They wouldn't have been doing the push-ups. They were doing the push-ups and getting results. Coming back to this whole question of like, how do people learn? it's interesting because the way we made our practice, and now it's not just me with an admin team. I've got Dr. Rachel, I've got coaches, I have an admin team, I have a communication team. I mean, we have people that work with us to help communicate whatever it is that we're trying to communicate. And the way that we've developed our system, James, is that over 26 years, we get feedback from our clients, what works, what doesn't work, what works, what doesn't work. And what we found is it's kind of what, and I didn't realize this until you just asked this. We have so I won't go through the whole thing, but we have resources like stuff that people can download and read. We have readables, we have videos, we have texting, we have people that can't maybe free thought, we have forms they can fill out to help them organize their thoughts. We've got different brains kind of weighing in, our collective brain of the coaches and the doctors. We're all kind of weighing in on these cases, but it's interesting, and we get great results by mixing modalities, so to speak. We also have group calls that people can come to in addition to one-on-ones with their coaches. They can come to group calls with me, with the coaches. So there's a community there. I think that's important. There's a visual, it's audio. I mean, there's a lot there. But interestingly, no matter how I slice it up, it's still the people that are showing up and doing the work and asking for help in the way that they need help. And when I always tell people, I think I'm brilliant. If I give you an answer and and it doesn't make sense to you, tell me it doesn't make sense to you. Like, don't let me talk to myself. I give me feedback. If you need me to say it differently 10 times in 10 different ways, I'd rather do that than me assume that you get it and then wonder why you're not doing the push-ups. Push-ups are my analogy. I don't necessarily ask people to do push-ups, but to do the work. It's interesting because I don't know, James, coming back to asking you a question. You've been in the coaching and headspace, work for a really long time as well. And Angie, I'll ask you too. I think no matter how we do it, making audio, video, groups, single, one-on-ones, written stuff, messaging, texting, I mean, whatever it is, it's still the people showing up that get the attention. And I think it comes back to what I'm always asking, how can we get people to show up? Like, what can we send out a text every Monday to every one of our clients asking them for an update. And then and those people that give us an update, we go back and forth and back and forth and back and forth with myself and the team with getting them more clarity through the week so that Friday's healthier than Monday, but they still have to show up. They still have to send us the update. I don't know. It's interesting. I'd pose that question back to you guys. What can we do to get people to do the work?
To get people to do the work. Well, it's interesting because, I think back when I was running a private practice, and I guess I hate that it has to come back to money, but it does, because I'm not going to work for free. And so when I was able to actually charge people for the time that I was spending with them, and also have them, you have it built in to where, like, if I'm available to them as much as as they need, that, like, then I would be kind of not chasing them, but I would be reaching out, hey, pinging them. How are you doing? How are you feeling after the other day? Like, how's it going with this? And I think that, that's worth investing in, right? Is having somebody who is, really tuned in to you. But we can't expect that. So the private practice that I work for is insurance based mostly. So people are paying a copay, right? So it's a different demographic altogether. And so I find myself in a situation now where I do what I can when I'm with them, and we make that time count. I get 30 minutes with them each session, but we can meet weekly, we can meet twice a week, and insurance will pay for that. And so I do encourage that, especially when somebody comes in with a more complex issue or a set of symptoms. We're meeting twice a week for a few weeks to really get everything fleshed out. but in the situation that I'm in, or in the model that I'm working within right now, this question is just, it's a little bit overwhelming, actually, because we don't have those systems
Mhm.
in place to really
Mm.
individualize it for people. I individualize as much as I possibly can, and I can do that because I worked for years, in function as a functional nutritionist, and I can spot the patterns. And I don't have to spend, hours and hours researching anymore, right? I can just spot it, and I know exactly what to recommend based on the symptoms that they're having. But getting people to do the work, to me, comes back to listening to
Mm.
them, asking questions, being interested in their experience, in their background, and communicating to them that there's actually nothing wrong with them, because
Mm.
the system the people I'm working with have been interfacing with the conventional system. They're still in it, most of the time. And so they're just being told at every turn, either point blank or, subconsciously, there's something wrong with you. There's something wrong with you. And so my job and the role that I'm in is to counter that, to be the voice that
Mm.
says, no, there's nothing wrong with you. There's never anything wrong. There's only something to be understood,
Mm.
right? So it just takes curiosity. And so
Mm.
I'm curious with them. I'm encouraging curiosity, for them to get curious about what is this about, what's out of balance, what needs to be brought back into balance, so I'm helping them to shift their perspective and their story as well, right? And I'm providing a space to, when it comes up and when there's the opportunity, yeah, I do want to know, what is that story? What are you telling yourself in that moment? What are you hearing, when you're about to binge, or when, you feel the worst about yourself and you're looking in the mirror, like, because a lot of body image stuff comes up. A lot of people come for weight, in the
Mm.
practice that I'm in now. So, um, I'm allowing them, giving them space to feel heard and seen, and validated in their wholeness, and sometimes I have to remind them, yeah, that of their innocence, we sometimes it goes really deep back into, some childhood traumas, and we just focus on that and we don't talk about nutrition. So anyway, long story short, or I'll wrap it up there, but that's my approach.
Do you want me to tackle that, Jason?
I've got comments, but I mean, I never get tired of the sound of my own voice. So I mean, go ahead.
Well, well, as I listen to how Angie shares the methods, and she talks from an insurance-based perspective and how there's a time allotment for the interaction. Jason, I know you're cash-based, you're concierge-based. You have a different approach to timeline and connection. So it opens up a different conversation, which I think is really cool. I think it's really impressive to hear both perspectives, because I want to bring this back to Angie after I make my comment, and I want to bring it back to her about how she has this duality with spirituality and shamanism, um, within the medical model that she practices that she's providing in. So, based on what both of you are sharing here, it sounds like parenting. I don't have kids, but the advice that both of you are sharing
Mhm.
sounds like you guys are raising children, and you guys are talking to people and creating safe spaces to share information and figuring out communication techniques that work best for that child. So it sounds like, we're taking the same nuances of raising children as to talking to adults about their health issues, our health concerns, or how to get through something with your guidance. So
Mhm.
I think it's just a really cool parallel to bring up. Um,
Mm.
Can I jump
Go
in
ahead.
before we pass it back to Angie? Just real
Well,
fast.
I
Go
wanted
ahead.
to share. I wanted to share my perspective
Oh
on that
yeah, do
question,
please.
but go ahead, jump in.
Okay, I'm going to, because you're letting me, and then we'll pass it back to you, and then back to Angie. I'll be really fast. I, for the first decade of my career, worked literally employed by insurance companies. They paid they paid, I was a network guy. I was in the network of everything. Right. And I was in some privileged, back when there were HMOs, I was in HMO networks and PPO networks, and I was in network with everybody and everything. I did get I had every year you get, at least I did, you get these reviews, utilization reviews. And one day I had my review with a certain blue colored insurance company, and they got on the phone. They're like, "Hey, Dr. Bradley, did you know that your name is requested to be added to more and more panels than any other doctor that we've ever had? Everybody wants you to be part of it. They want to be your patient." I'm like, "That's great." He's like, "Did you also know you're the most expensive doctor in the state?" And I was like, "How is that possible?" He's like, "No, I mean, seriously." He's like, "I want you to know, like, even with surgeons and anesthesiologists," he's like, your per head cost is higher than anybody in this state." And I was like, "That's awfully strange." And he's like, "Do you know why?" And I'm like, "Well, I order a lot of labs. It's true." Yeah, this was before there were like wholesale labs available. There's a whole bunch of like really affordable labs that are available now. This was like 20 plus years ago, right? So about 20 years ago. And at any rate, because labs are very affordable now. But anyway, I was ordering labs, and I was, telling the insurance companies to pay for it, and I was coding it all the right way. And this is what he told me. And this is my experience. He said, the problem that they have with me and my utilization, is that I treat everyone like they have Cadillac insurance, and that some people don't get to drive Cadillacs. Some people drive, and this was what he used, Yugos. Those aren't even cars anymore. But they were like crappy little cars that were notoriously just crappy. They were like $2,000 new, and they fell apart within a month of owning them, right? They were just like junk cars. And he's like, "You're treating the people that have Yugo insurance like they have Cadillac insurance." And I said, "Oh, okay. So what you're telling me is that people that have better insurance should get better care." I got it. People that have shitty insurance, I'll be a shitty doctor for them. I'll be a better doctor for people paying more. And he's like, "No, Dr. Bradley, we would not tell you to do that. We want you to practice the way that you need to practice. You get good outcomes. You get, you're heralded and requested. We're just saying," and he used this Cadillac Yugo analogy a couple of times. And what happened with me, James, is that I quit that day. Or at least I turned in my notice with that company, and then subsequently every company. Got into a legal battle. They wouldn't let me out of my contract. They made me own up to my 6 months termination notice. And it was awful. They weren't paying me for 6 months, and I also couldn't charge anything to anybody that was in network because I had a contract with them that I could only get paid directly from the company. Anyway, beyond all that, when I moved into private pay, it was very scary for me. Very, very scary. And I lost 90% of my clientele because people want to stay within the system because they pay ungodly amounts for their insurance and want to use it. And I understand that. I will say that I did fire my insurance company at the end of 2025. And now I'm with some health membership groups that I won't talk about right now on this call. But nonetheless, I fired them for many, many reasons. Egregious extortion level monthly premiums being one of them. But all that said, when I moved to private pay, and I was really able, and I think I got this from Angie too, it's just different. It's a different clientele. And what I found was the people in my private pay system, which I'm in now, people that hire Rachel and I to be their consultants, people that and our coaches that work with us, and our clients, those people tend to do the work. They're literally coming up with their hard-earned dollars to hire us to help guide them to along their journey. And it's a different, at least in my experience, it was a different idea than I'm going to pay my $15 copay or whatever it is, and I'm going to expect everything to be solved right now. I love with Angie that insurance pays. There's so much here that Angie gets to meet with them a couple times a week, but also she's bringing her graduate level nutrition training, and all that, to this service, but also all her shamanistic training as well, and her transpersonal and transformational, coaching. I mean, she gets to bring so much to that. The unfortunate part is most people in her position don't have that, so I mean, her patients are very, very, very fortunate to have stumbled across her, to be with her. So I think that it's really cool to be able to blend that. So that was just kind of my take on private pay versus outcomes. The other thing I wanted to comment on that Angie said, which is totally right, there's nothing wrong with people's bodies. In medicine, in healthcare, there's a drop down menu that's a diagnosis code, and something's got to be wrong to get paid. You don't get to drop down and say, hey, James came in today and there's totally nothing wrong with him. He just wanted to come in and check in with me. Not going to get paid. That's not going to get paid, except for your crappy, preventative medicine wellness visit once a year where they do a shitty CMP, CBC, lipids, and a TSH and maybe a free T4 and call it done, because those are all going to be normal for the most part, unless you're really, really sick. But symptoms are the way of the body talking to us. Symptoms are warning lights, but they're not that it's sort of that something's wrong, but it's really a sign of healing. The body is always trying to adapt. I mean, James, we always talk, and Angie, you might have heard this. We always talk about the universal intelligence. Some people call that God, the universe, the source, whatever that is. And then the innate intelligence, which is that light that's within us, that energy, that coding from God, from the source, that innate intelligence. And then we have the educated intelligence, which is what we learn along the way here, which is often gets in the way of the other two. That said, the body's innate intelligence is always trying to make you healthy. Always. No matter what's going on, it's trying to, sort out, here's all the input that I'm getting. Oh, this person eats a crap ton of sugar. I better increase insulin, so that they don't go, into a sugar coma. And then our insulin receptors get thrown off. And then now all of a sudden they have diabetes, pre-diabetes, and then diabetes. But it's not because the body isn't working. It's because we're giving it the wrong input. The body's signals that we're doing that, coming back to strategy, we're doing something wrong. It's not that the body is wrong. It's that we're not doing it right. And so that's where transformational and transpersonal coaching can come in, like Angie, and coupling that with diet and lifestyle in the model that she's in right now. I think it is transformative because we get to teach people, hey, it's not your body. Your body knows how to be healthy. I mean, it knows. It's got innate programming, DNA, like it wants to and knows how to be healthy. We just got to give it the right input, So again, I come back to unlearning, reprogramming, and then I'll pass it right over to you, James, to kick it back to Angie. The last thing I wanted to say is, 2025 was the year of the snake. We've outgrown our skin. We're shedding our skins, right? Hopefully those of us listening, or our listeners, our GBF Nation, is like, what? I did grow a lot in 2025. I am a new person, right? Because 2026 is the year of the fire horse, right? And the thing about the fire horse is that it's a trailblazer. It literally is a trailblazer. If you shed that skin, if you grew out of that old skin, that old you, and you are your new self, you're going to trailblaze. You're going to set it on fire, running forward with momentum. But if you didn't, it's going to be like pouring gas on a fire of that old self that needs to be come into focus and dealt with. And in 2026, you're going to be one of those two people, in my opinion. So it's still an opportunity to burn away the old self, and be the new self. Or trailblaze forward, hopefully I like the forward momentum. But anyway, that's my thoughts on all that, James. Thanks for letting me share that. Angie, thank you for yours. It really made me think about a lot of things. So thank you, James, back to you.
Yeah, this is a really great roundtable style interview discussion today. I think it's a different path that we've had from most shows. So thank you both of you for allowing the fluidity of back and forth, and in the triangle method of, letting the both practitioners speak about methods and best utilization. I think it's really eye-opening for people to listen, because they're not going to hear these types of conversations anywhere else. They're not going to hear two practitioners go back and forth about the styles that they practice and their ideal clients and ideal communication pathways and things of that nature. So thank you both for sharing how to best get people better faster. And to Jason, you asking the last question, I might have forgotten some of it, but you referenced from a framework early on in today's talk where I'm from. Well, I'm a man from Davenport, Iowa, and the lineage I grew up in is you don't go to the doctor. Doctors are places you don't go. So that reinforces the method of why women are probably your ideal client base for both of you, because women are guided to get doctoring. Men are like, hell no, I'm not going there. That's the last place I'll go. I'd rather my damn leg fall off before I go see one of them. And that's just the world I come from. So for me now to be an advocate for natural health providers and chiropractors and functional medicine practitioners, it's a whole different model for somebody that was raised the way that I was to think about the medical world. Like, we did everything in our power to not ever go to a doctor. Like, we'd have to be dying before we would go to the damn doctor. So that's the method of the brain that I was like born into. So thinking of like how to high level think of ideas on coaching and personal development and like things of that nature, we have to think about like, who were you before this? Who are you now? Who will you become? And I think that that's a fair assessment for somebody like me that's a patient or a consumer. By the way, I've never had medical insurance my entire life. I'm 47. I wouldn't go to the doctor if I had to still. I rely on people that are outside the medical matrix. So when people think about big box medicine and the pharmaceutical industrial complex, I am the farthest removed from any of that connection. So when people hear what I have to say, I don't come from the idea that doctors are gods. I come from the idea that if I need that person, it's a means to the end. It's not a relationship that we're going to keep a long time, guys. Like, it's going to be like, I'm coming to you because this is an issue and this is the situation. And you guys are going to be my advocates to get me through this moment of my life. Like, this isn't an ongoing thing where I'm going to be connected to that practitioner. So I come from a different, I guess, cut from a different cloth of how I see the doctor medical arena. That's why I'm an advocate for sharing information like this, because people need to get these types of conversations that aren't captured in the military industrial complex of pharmaceuticals and big box medicine and control. Like, these conversations are outside the norm. They're outside
of the medical industrial complex.
Yeah. Well, wherever it's coming from. But my question after I got a chance to share it, so thank you both for listening, because I think it's important for people to hear who we really are rather than just a couple hosts that, have conversations with really awesome people. I think it's important for the people out there to know why we do this job that we do, because I could do anything in this entire world. But what I want to do is I want to create this new constellation in the sky of providers that are all connected in this get better, faster community that are all able to hold space for people outside of that mainstream arena. So I know that we source the best, brightest minds to come onto this show to share their genius with us. So that's why I give my time and my talent to this type of agenda, because I know it's going to help people. And that's my ethos. But I wanted to ask you, Angie, after I finished, what do you think mainstream nutrition gets wrong? And how can we make a correction?
How much time do we have left?
Well, I think it's starting to catch up, I think, but yeah. I mean, like, when I am talking to people and I'm focusing in on blood sugar, I have to tell them, I didn't actually learn this, in my education as a dietitian. We never talked about blood sugar unless it was in the context of full blown diabetes, right? I actually had to, after my master's in nutrition and my dietetic internship, delve into, different forms of alternative medicine, Chinese medicine, Ayurveda, naturopathic medicine, and looking at, just educating myself. And because really I had my own symptoms, that I was having with energy and mood swings and irritability, and where I finally figured out that it was all about blood sugar.
Mm.
Um, and then learning too along the way, learning about functional nutrition, that's one of the best ways to bring inflammation down, right? So with someone with autoimmunity, that's the first thing that I'm doing with them. It's not a bunch of supplements, it's like, let's just make simple changes to your diet, but in a specific way that you're eating for optimal blood sugar. You're not white knuckling. We're not on a diet. Like, this is sustainable. It actually feels good. And so I think mainstream nutrition gets it wrong by hyper focusing on calories, um, and making it about, like, eat less, exercise more. Like, it's not that simple, and it's too generalized. And so it gets it wrong by not individualizing and not understanding how to individualize for each person, and to really know the key things, small changes that create big results for
Mm.
people in the way that they feel, and in their metabolism. um it's for me, it's all about, maybe because I don't know, like, I don't I don't like to call myself names, but I jokingly say that I'm lazy, and so I like to work smarter, not harder. Like, I have found the shortcuts, to make it to where it's not hard, it's
That's
not
efficient, not lazy.
grueling.
That's efficient.
Yeah, there we go. I'm efficient.
Yeah.
So, yeah, I would say, and I feel that mainstream nutrition, um, yeah, well, I'll just leave it there. It's not individualized enough.
Well, I want to jump on to the next level of
Hmm.
this with you.
Yeah,
So
yeah.
if somebody out there is like thinking sugar free or fat free, I'm just going to
Hmm.
tell people right off the jump, that's not food. Don't eat that.
Hmm.
So
Hmm.
if they're telling you, I'm not a dietitian, but if it's sugar free or fat free, it's not food. Don't eat it. It's
Yeah.
made up of chemicals and it's not real stuff. So eat whole food based stuff, like eat real things.
Mhm.
Um,
Right. And then let
sorry.
me just say, because there's this, like, no, there are no bad foods, and I don't like to label things bad. But maybe it is about real food versus not real
Yeah.
food, right? And I feel like I've seen the difference between myself and, like, mainstream dietitians, where it's like, we're just including all of this, like, processed food, like, that's not real food, in these people's plans, because all foods are good, all foods are acceptable, but
It's not true.
we have to teach people discernment, like, yeah, be let's not be hyper vigilant. Let's not promote, like, orthorexia, right? And also, let's learn how to discern what is real food and what is not real food, and what is actually going to what is going to be life-giving,
Hmm.
essentially. Yeah.
Jason, do you want to jump in or do I get another shot at a question?
You have a shot, but I just want to say I've been accused of creating orthorexia. For our
Me
listeners,
too.
ortho
Mhm.
means right, and then eating, basically eating an obsession with eating the right food. And I've been accused
Mhm.
of this by a few different doctors, some of them friends of mine, and I've had conversations about this exact word. The right foods that my clients are obsessed with eating are real foods, not box can wrap packaged processed, right? And they're not militant about it, but they're not eating foods with additives. They're not eating foods with extra,
Mhm.
trans fats and sugars or fake sugars or this. And they're just
Mhm.
going to the vegetables and the fruits and the real meats
Keeping
and
it simple.
like
Mhm.
really simple foods. If they're having
Mhm.
dairy, they're getting the heavy creams and the organic milk and the cheeses and whatever they're doing. And I asked them, I'm like, when did it become a sickness, a diagnosable sickness, that people just want to
Mhm.
eat healthy food? And I don't have that
Mhm.
answer, but I've been accused of that for the last couple of decades. So it's not
Mhm.
new. It's not like right now. This has been around for a little bit. And then I asked my doctor friends that are diagnosing people with that. I'm like, well, how are you going to treat that? what are you going to do? And they're like, oh, you need to open up food more. You need to, like, don't be so restrictive. And I'm like, what do you mean restrictive? Like, am I supposed to encourage them to eat shit? Like, I mean, literally, like, you know what? I don't want you just eating good food. You should go to McDonald's at least twice a week and load yourself with way too much sodium and Franken foods and Franken meat and all this, like I mean, literally, like, what are we supposed to do? And, chemicals. I mean, McDonald's food is not just like too much of something. Like, there's actual like bad chemicals in there, along with most of the food in the grocery stores. And they don't really have an answer for that. They're like, it just doesn't seem healthy to be restrictive to only eat healthy food. And I'm like, I can't even my limited faculties cannot even process what you're saying, because I just want people to eat good food. Like, I mean, it doesn't seem like a hard. Anyway, I'm done. Orthorexia, everybody. That's what it is.
Well, it gets me back to I just think hosting this with you, Jason, is so fun, because you get a chance to share where sometimes people miss the mark, and where we're supposed to be all inclusive, and all inclusive gets people cheap results. It leaves them in the pathway of least resistance, which doesn't get them better quality of life. And if the insurance game wants people to have better activities of daily living, then we have to break free from the mold of being all inclusive for what people are feeding themselves. And we have to be more strategic on eating real food. So, like I said, if it's sugar-free or fat-free, it's not real food. And that's just my take on the world. Question for you, Angie. And I know we don't have a whole lot of time left, but maybe you can give us a synopsis. Where is the field of nutrition and shamanism and mindset going in the next half decade to a decade? Where do you see it going?
Well, I mean, I don't know about the field, of those things being merged. I mean, obviously there are those of us who are merging it, but honestly, I mean, I feel like it's all about integration, like for me as a practitioner, I don't show up with a rattle and feathers, but my shamanic training and experience just informs who I be, who I be as a practitioner. And it allows me to be sensitive, attuned, like that's really what shamanic practice is about attunement. Right. And so I guess then I would say on that note, that it is headed toward more attunement, more intuitive teaching, intuitive eating, and meeting the moment intuitively with people, to sense like what is it that this person really needs right now, like completely off script, completely off protocol, because it's each person is so different in what it's so different and also very similar in what they need. And so I feel like what I would love to see anyway is more integration, of the body, mind and spirit. Sounds cliche, but this understanding of the body as there's a couple ways I could frame this, like a biofeedback machine, right? Or there's this really great channeled Yeshua text where he says the body is a teaching and learning device, right? And so it's like that's what it is. And if we can learn to look at it in this way and get curious about, okay, what is actually, I like to say, instead of asking a question, it's more like, thank you for showing me what is unresolved in me, what is needed right now. You always do that. Thank you so much. And when I do it that way, instead of asking, what do you need, what are you showing me, from that place of gratitude, as in the energy of it's already done and I'm totally trust you, you're going to reveal it right when I need you to, that's when an insight will come up, or maybe the next few seconds something will show up in my feed. And I'm always telling people, you have to believe that the right information, the right people are always going to show up when you need them. Like, this is you relying on a greater intelligence, to help you resolve this. It's not just you. You don't have to figure this out with your mind. And you also don't have to give your power away to someone else to figure
Mhm.
it out and fix you, like actually working with a greater intelligence to inform,
Oh.
your healing and your unfolding, and bring you everything you need. I would love to see things going in that direction where people are working
Mm.
more with their intuition, and practitioners are also encouraging that and teaching that.
Mm. That's
And
so
we should
powerful. That's powerful.
and we should reward the practitioner for getting people off medication rather than putting them on more. Just my 2
Yeah,
cents.
Amen.
for sure. For
Amen.
sure. Yeah.
I want to just double down on that too, Angie. Thank you for sharing that. That was beautiful. And we're in such a trust the science state of mind. And as James, I won't get into it right now, but I mean the science is even questionable because you pay to play in the journals. And so even the journal editors are saying, if you're published in our journal, you've paid us to be in your journal. And that's New England Journal and British Medical Journal and Lancet and all of them, right? So, I mean, what is the science anymore? I don't know. So if we genuinely can't trust the science, and I'm not saying there's not science out there. I'm just saying science is a political, like there's a political wave to it, I mean, it's fuzzy.
Mhm.
It's fuzzy. It's not
Yeah.
black and white, right? I mean, a long
It's
time ago,
it's the intellect. We
yeah.
can't function with just our intellect,
Right,
right?
exactly, and I think I
Mhm.
would love to see more intuition, more
Mhm.
divine consciousness, more,
Mhm.
connecting to the creator. I love all of that. Again, we talked about universal intelligence and innate intelligence, connecting to those areas, and I think it's beautiful.
Mhm.
I appreciate that James brought up, "Hey, where are we going in the next half decade to decade?" And thank you for sharing that. I wanna bring it back to today, because we're closing out our show, and Angie, we're gonna have you on for a second episode. We'll have you on for part 2 down the road. I've got 28 questions that have come up, and we have exactly 3.5 minutes to go over them. So, but here's the thing. Stacy Rose posted, and I don't know if you saw that comment.
Yeah.
Back when we were talking about blood sugar, she said, "What about gluten and carb control at the same time?" So I'm gonna put a pin in that and just bring that. Oops, sorry. Bring that back up here in a second, but it dovetails into my question. For our GBF Nation listeners who are here right now thinking, this is exactly what I need, right? What is something that they can do today? Not 5 to 10 years, where are we
Mhm.
going? But what's something,
Mhm.
if they're overwhelmed with their health challenges, battling food anxiety, feeling disconnected from their body, disconnected to what I would call source or spirit, however you want to, say that. I'm not a shaman, but that's the words I use.
Ye
What's something
Mhm.
that they can do today to start shifting toward that healing?
Yeah, okay. So I would say, first and foremost, work with what you have available to you at all times. It's totally free. You don't even have to go outside to use it, and that is your breath,
Mm,
right? And so just slowing down the breath, deep inhale, slow exhale, inhale through the nose, exhale through the mouth. Just sensing what's happening in your body. You just sensing your feet. That's a great way to just bring yourself out of your head with all the worry and the anxiety, the health anxiety. Like, that's all happening in your head. That's all happening in your intellect. Slow down and breathe so that your attention comes into your body, right? Into the present moment, more present moment awareness. And if you can, once you've created some space in your consciousness by just breathing and relaxing the body, right? Then actually that frees up the space in your consciousness for insight to come through.
mm,
Like, you actually might find when you take a few deep breaths, or go do legs up the wall and listen to, some healing
I just recommended
frequencies.
that to somebody this morning.
Did
What a
you?
what a
Yeah, it's a
out
good
of all
one.
the things to pull out of the air. I mean, literally, I'm like, just lay with your legs up the wall and do some breathing. I'm
Yeah.
telling you, there's some synergy here. That's cool. Thank you. I just felt validated.
Yeah, of
Thank you for
course.
validating me.
Of
I appreciate
course.
that.
Yeah. Intuition, but
Right,
but we're
right.
on that same, that similar frequency of, before anything else. I know people just want to hear, okay, tell me what to go get, what to supplement to buy, what to do. But really it's about being present, be here, slow down, be
Yes.
with yourself. And yes, legs up the wall and doing some breathing is a great place to start. It sounds too simple, people always want to be figuring things out. It's just because the mind likes to go, go, go. But we have to counter that. We need that pattern interrupt. The breath is the perfect pattern interrupt to
Mm,
get us out of that overthinking, which is activating our sympathetic nervous system and, creating that cortisol release and dysregulating, not only our nervous system, but our metabolism, and driving inflammation. So really, it's so simple. Um, you just have to do it. And then I would also say, as much time in nature as you can possibly get as
mm.
well. Even if it's just honestly looking out and watching a sunset, even if you can't get out into the forest, watch a sunset, watch a sunrise, look up at the stars, because that's going to shift. Again, it's all about perspective. A Course in Miracles says healing is simply a shift in perspective, right?
Mm.
So we have to shift our perspectives. And that's something that we do over and over and over and over again. It's not something you do one time and then it's done. No, we have to choose to do it over and over and over again. And and it's what was I going to say about that? It's a cumulative effect over time, right? You actually, it feels really good when you do it in the moment, but the more you keep shifting your perspective, the more that muscle grows, right? Of being present and being here in your body.
I really appreciate that. Thank you. I always make the joke that 3 doctorate degrees, a master's degree, 3 or 4 board certifications, and I tell people to drink water and eat real food and move a little bit each day and breathe a little bit and get some good sleep,
Hmm.
in a nice regular rhythm, and surround yourself with a nice, loving, and healing and supportive community.
Yeah, for
It's
sure.
just very interesting. I think all of what you're saying and those pillars probably are more healing than any drug on the planet, right? I mean, it ultimately
Yeah.
just
Any
really
drug,
curious.
any supplement. Yeah.
Yeah. So
Hmm.
I'm gonna do a rapid fire. Just what do you think about it? And then I'm gonna hand it over to James for some closing remarks and whatnot. I know we're a little bit over. Thank you for your time. Stacy
Oh,
Rose
thank you.
again. Gluten and carb control at the same time. What do you think? Good idea?
Yeah, it's a good idea, but I would say start with the carb control, right? And it's really not about limiting carbs as much as it is about not waiting too long to eat, especially for women, because
Mm,
we can't fast as long as men. And then there are different times of the month where we can fast a little longer, so it has to be more tailored. But balancing, I would call it balancing blood sugar.
mm.
Like start your day with 30 grams of protein, eggs, Greek yogurt,
Okay.
if you tolerate dairy, but get your blood sugar regulated. Don't wait too long to eat. Actually, it's okay to wait a little bit, but don't wait too long to where you're in that crashed state, right? Get that. That's where I have people start. I'll go over the plan, but the first thing I want them to do for the first week is just get really good at that
Mm,
first meal, and making sure that it's very stabilizing to their blood sugar,
I
and
love
then to
that.
watch and see how that ripples out to the rest of their day, how it impacts what they even want and how much they want to eat, how it impacts cravings later. So first start with the carb control or the blood sugar regulation, protein, fat, and fiber.
Yeah.
And then, then we can look at gluten, but actually you can do that very easily without gluten, right? So there's many sources of real whole foods that don't include gluten. So it's just, about educating yourself instead of feeling of making it about, oh, I can't have gluten. No, find the things that you can eat
Mm.
that are delicious and amazing and nutritious that don't have gluten. There's plenty of options.
Yeah, absolutely. And it's the same as like giving yourself space to breathe and meditate and just be with
Mhm.
yourself. It's kind of the same idea.
Mhm.
Like instead of thinking, because it's not like, oh, I'm taking something out of my day. It's actually you're getting downloads at that point. I mean, you're going to be filled up with so much. Same thing with
Mhm.
whatever. If you're cutting carbs or cutting gluten, I mean, it's just opening up for more healing. There's going to be other things that might be uh, more healthy inputs for your biofeedback machine that we call the body. So I like that. Thank you so
Mhm.
much. I know we're over. James, I'm
Yeah.
going to pass it over to you for some closing questions / remarks.
Great episode today, guys.
Yeah, it was.
There's lots of good information shared, lots of personal perspective shared. And to bring it all together is what people pay for, they pay attention to. And if it's cheap, fast, or easy, you probably shouldn't do it. So those are things to consider.
Yeah.
Um,
Although there you can do, there are some ways to do cheap, fast, and easy that are natural. We got to find those.
yeah,
Plug
but if it comes to the things that we're eating, you should probably really reconsider how we're spending our bucks for the energy and the fuel that we put into our body. That was what more formatted for the statement there is what we're feeding ourselves as fuel. If it's cheap,
Mhm.
fast, or easy, it's probably not a good idea. But maybe that's just my perspective.
No, it
Um,
is. I agree with you, but I'm just saying there are also ways to do it in a good way too. We just have to tune into that.
and if you prepare well for it, it's
Mhm.
not
Right.
it's not the same.
Yeah. Yeah.
But yeah, Angie, it's been absolutely transformative. I'm sure anybody that's listened to the show today really appreciate your perspective on many things when it comes to um, just finding the access to give themselves permission to thinking differently and interacting differently with themselves. I think a lot of your core message was get right with yourself and you can get right with the person that's your guide. And I think a lot of that makes sense to me. If you get right with you, then it's easier for you to get right with the person you're asking advice from. And for our listeners, if you've ever felt like your body is working against you, like some of the discussions we were talking about with Hashimoto's or thyroid issues, or just not feeling good looking at yourself in the mirror, if you feel like you're stuck in a cycle of restriction or confusion or frustration around food and health, maybe we call it brain fog, or you're saying, Jason, you're talking about being in state. When people are not in their proper state, they don't have good clarity. And Angie and Jason gave you a roadmap to flip that entire script today. And if you guys want to, head on over to getbetterfasterpodcast.com to connect with Angie and explore her offerings and start your journey from food prison to food freedom. And remember, nobody is coming to save you, or as Jason says, no one's going to do your push-ups for you. Solutions like this prove that you can save yourself and you can do your own push-ups. You can even watch how to do them on YouTube. Angie, thank you again for sharing your wisdom and your heart with the GBF Nation. And to you all, our GBF Nation, thank you for listening and for your continued support. The best way to show your support is everybody. I say it every time. Share this episode with somebody who needs to hear this message. And don't forget to subscribe so you never miss an episode and get all the behind the scenes insights we've got coming your way. And we get asked this all the time, how to work with Dr. Jason and his incredible functional medicine team at Radiant Life, Radiant Health. Just click the link to getbetterfasterpodcast.com and we can get you connected. We've got more incredible guests lined up who are going to blow your mind with real solutions for reclaiming your health, your happiness, and your life. Until next time, keep questioning everything and keep getting better faster. Angie, Jason's really a remarkable interview today. Thanks for spending some time with me today.
Thanks, James. Thanks, Angie. I
both.
love this. I love this episode. Thank you so much. And thank you everybody for listening.
Pleasure.
Yep. Bye for now, guys.
Bye for now. Love y'all.